Joel Snover is an accomplished athlete at Lakeshore High School. He found his dream to play football at the college level in question on the very first play of his homecoming football game. Playing on defense, Joel was engaging an opposing lineman.
Both my feet were planted into the ground, and my fellow teammate, the other linebacker, ran by, got tripped, and fell into my leg. And I just fell to the ground, and I just hopped off it.
He fell into the side of your leg?
Yeah.
The outside of your leg. Was there pain?
At first, yeah. And then for probably like 30 minutes or so, there was a lot of pain, and then it kind of died off. But when I tried to walk or stand, my inside of my leg just gave out.
It so happened that Carrie Walker, who works with the athletes at Lakeshore High, is also a certified athletic trainer with the Detroit Medical Center. She examined Joel on the sidelines and suspected a torn anterior cruciate ligament, or ACL.
So then at halftime when we went in, laid him down, did a couple other special tests, and was about to jump off the table because it caused a lot of pain. So we definitely knew that it was for sure ACL and probably something else going on.
Joel was taken to the Detroit Medical Center's Sports Medicine Institute, which specializes in the treatment of, among other things, athletic injuries from the initial exam through rehabilitation.
It's a whole continuum of care, and we really want to make sure the athlete's getting the best possible care. And because I work at the high school and I know him, I know that the DMC can give him the best possible care.
Joel was seen by one of the best orthopedic surgeons in the country, Dr. Stephen Lemos, one of the team doctors for the Detroit Tigers and Detroit Pistons, is the director of the DMC Sports Institute.
Let's look at you this side. Just tell me if it hurts. All I want to do is find out what's wrong, not hurt you, okay? Tell me if it hurts.
Yep.
Right there? Okay.
Dr. Lemos confirmed what was suspected. It was indeed an anterior cruciate ligament tear. The ACL, which prevents the shin bone from slipping forward out of place, would need to be reconstructed, or Joel would run a very high risk of injuring himself even more seriously in the future. Prior to surgery, however, Joel would have to undergo 6 weeks of physical therapy.
It's very important to make sure they have full range of motion before the surgery. He had some swelling still, and even though his motion was good, it still was not perfect yet.
Do the abs tight, pull it in, and slowly control it out, but don't lose your core. Good.
And so for 6 weeks, Joel worked with a team of therapists at a Rehab Institute of Michigan satellite center not far from his home. Full range of motion was the concentration to prepare him for surgery. Finally, the date of surgery arrived. It involved using a section of tendon from Joe's kneecap for the reconstruction of his ACL.
We take the middle 1/3 of the patellar tendon, okay? We take a bone chip from here, like this, okay? And a bone chip from here, like this. And this will all be done underneath the skin, okay? And this will replace the ligament that he had in there.
It was minimally invasive. Dr. Lemos working through an arthroscope.
So the ACL should be in there, and it's largely empty. There are a few remnants here. You can see right up in here, there's just one little remnant, but that's nothing.
Through an incision in the top of the knee, Dr. Lemos took the 1 centimeter wide piece of patella tendon he would use to replace Joel's ACL.
How does that heal? Do you sew that back together or what?
I reapproximate it, and then it grows, and it's actually just as strong as before the procedure.
Finally, Dr. Lemos positions the new ACL and secures it with screws. The bone chip at either end of the graft will fuse in time and be permanently fixed in place.
Well, how did everything work out?
Really well, I thought. The repair was very good. The reconstruction was very good. And his knee motion is completely normal.
Joel was walking after 1 week, and 6 months later, after steady rehab, was ready to get back on the athletic field.
When's your next season?
Couple months, about a month.
Couple months? Okay, so we're going to work real hard,
Yeah.
get you ready for there. But I think as far as your ligament goes, I think you're ready to go. I think you just have to do a little bit more work on getting that thigh strong.
And so that dream of playing college football is back on track, and Joel is looking forward to it.
Since I had Dr. Lemos as my doctor,
My knees felt amazing. I know I won't have to worry about it any time from now. I know that since he did it, I don't have to worry about it. I know I can go out and play sports. It's just great. I'd recommend Dr. Lemos because he's a great doctor. He did a great job on my knee. He's very kind. You go in there, it's a very home place, like a homey environment. It's just a great place to be.
Visit us at dmc.org to schedule an appointment with Dr. Stephen Lemos or to learn more about the Detroit Sports Medicine Institute. For the Detroit Medical Center, I'm Emery King.